Hello everyone, I'm Dr. Prachiti Gokhe. I work in surgical gastroenterology department at AIG Hospital. My colleague Chidanand and Jenny will be joining shortly. First of all, I would like to congratulate you all for having a good rank, and I believe the counseling has begun. I mean, the choice filling has begun. So, we are gonna, I mean, you can ask your doubts regarding institutes and whatever doubts you have, and all of us will try to sort out your doubts. Chidanan, are you there? I think Jenny has also joined. Chidanan, can you hear me?
Hi, I'm here.
Hi. Okay, so that's Jenny and Chidanan. All you can unmute your mic and you can start asking. Yeah, I am in second year. I mean, all of us are in second year right now. I I guess guys, you can unmute yourself and ask questions. Also, Bhushan is asking how is AIG. Jenny, you want to take that?
AIG is good. Uh, I guess it depends on what your priorities are. Like, that is what one of my seniors had told me when we were filling in our choices for counseling. So, for me, I didn't want a bond. I wanted an institute with good hands on, but also which has academics regularly. And so, AIG fit into a lot of criteria in that sense. And also, the working environment is good. So, I mean, that's the general thing. If you want to know something specific, you'll have to ask so that we can tell you more, like specifically.
Yeah. I mean, for me, I mean, yeah, like Jenny said, the priorities matter. I mean, lot of you would be married and they would want to stay close to their family and all these, I mean, factors to be considered. So for me, I wanted to stay close to my family. That's why I chose Hyderabad. And I like Jenny said, no bond. Even I wanted no bond. So that's how we landed up here. Okay, so Akash is asking if you have an option, Gangaram and Medanta, between Gangaram and Medanta. I think Chidanan can answer that.
Hello, hi. I have some problem with network here, so bear with me. Uh, Between Gangaram and Medanta, it again depends. Now, Gangaram, most of the faculty, which as far as I know, they have a host of new faculty. And Samiran Nandi sir is almost retired. I know Soumitra Rawat sir is also not much involved in, I think, routine stuff. So, as far as I had inquired 2 years back, not much of hands-on in Gangaram. Even in Medanta, the situation is same. But Medanta is more structured teaching pattern as far as I have heard. One of our consultant is from Medanta, and we have a batch, senior also in Medanta. So their academics is bit strong than compared to Gangaram. And cutting chances more or less, you can't expect much in either in both the places. So frankly, I when I spoke to a pass out from Gangaram, he said, "Yeah, I was able to do 2 to 3 lab queries in my final year." That's what he said. So that's very. I can imagine that like you can get to see the advanced skills and learn it, but not more hands-on. Medanta is bit better of Gangaram.
How is Kim, Sunshine, Pace, and Yashoda? How should I arrange my options? Okay, so I think Jenny, you should answer that.
I actually don't have any clue regarding Kim's Sunshine Pace or actually even Yashoda.
Hmm.
The problem with this is, however many people you ask, you will get that many different opinions. So it is, if you want to know about specific institutions, it's better to speak to someone who is working there and then decide based on what they say, because we have, like, whatever we information we have is all from 2 years back, and it's going to be second-hand information.
About games, I can put in a few points. Like the academics there is, I mean, it's decent. I mean, Sastri sir, who is there, who heads the department, I believe, is very particular about. I mean, he will train you from exam point of view. Lot of transplant are happening in games, so you will have an experience. But hands on, I don't think it's it would be average. But yeah, you do get a transplant exposure there, and academics, yeah, it's good there. I don't think I know much about Sunshine Pace because Sunshine got seat only last year, I think. That's right, right? I mean,
Yeah.
yeah, Sunshine and Pace are relatively new. Yashoda, I don't know. I mean, I don't have much information. Okay, what should be, Bhushan is asking, what should be preferred? Quality, quantity of hands-on, like Osmania versus AIG. And okay, so I feel, I mean, as far as I believe, the quality matters. I mean, the whatever you are doing, the cutting and everything, you if you talking about hands-on, it should be mentored, it should be, supervised. So you should know which when to operate, how to operate, and what steps to do in what way. I mean, I feel that is more important than the quantity, because no matter how much you do it, it's all. I mean, we never feel satisfied because with practice only you'll get better. So I think obviously it's quality of the hands-on over quantity for me.
Yeah, I think it's the same for me.
Yeah. Any idea about Osmania Chidanan? How are things there?
Osmania, again, as we said, have got second-hand information itself. I've spoke to 2, 3 registers there. So the thing with Osmania is now the seats have been increased to 5 from 1. That's a very drastic jump. I don't think there's so much of work there for 5 residents. For one resident, it was well and good, and it was worth it, I feel. As I spoke, by the second year or third year, they were able to do LPJ, open on cutting they used to get. But the variety of cases between AAG and Osmania, any day AAG has got more variety of cases. But Osmania has got more used to have more hands-on than AAG, frankly speaking. But now with 5 seats, you have to think about it. You have to speak to the registers over there and be prepared to uh, work for overtimes and all at Osmania. You have got to do more work at first year, basically. It's a government setup.
How is IGIMS?
AGMS, no idea at all. Any idea, Jain? Jain
Oh
might
my
be knowing.
God.
Because
IGIMS is Patna, right? Or Delhi?
Yes, yes, that's Patna.
No. Okay.
the good thing about IGMS is there's no bond there as for Zain. It's a central institute, and there's no bond there, and Pradyuman might be knowing about IGMS. He had one of our batchmen was he had an option of AAG and IGMS, but he preferred AAG. I don't know why.
Hmm. Okay, so what should be the order between Kim's, Sunshine, Pace, and Yashoda? Hmm.
Again, not
To say, don't
very
know.
sure. Yeah.
I think Pace and Sunshine would be in the last because only first batch is there. So I don't know much idea. Kim's is relatively better. No idea about Yashoda, man. Next, Tumar is asking many of DRNB residents currently pursuing SGE suggest better opt for Onco. How do you take that?
It depends on what you want to do. The difference between SGE and Onco is that in SGE you're doing uh, mostly abdomen, a lot of GI Onco. In Onco, you are also doing other things like head and neck, maybe retroperitoneal and breast, thyroid, all of those things which we don't do. So it depends on where your interest lies. Like for me, I was very clear that I wanted to do gastrointestinal. I was not interested in the rest of it. So for me, surgical gastro was a better option.
Hmm.
Yeah, generally more than institute, branch matters. Institute doesn't matter much. So after 3 years, any one of you from any institute, you are gastroenterologists. But there's a hell lot of difference between gastro and onco. So first be clear about branch. So there's very much high difference. If you want to be an onco, then you want to go for onco. There is no much difference between DNB and MCH. Even in hands in by law also, if your DNB institute has got more than 500 bedded hospital, it is considered equivalent to MCH by law. But if it is less than 500, then you have to do 1 year of SRship to be considered equivalent to MCH. So choose the branch first and then think about institutes.
And what about Lilavati Hospital? Any idea about that?
Okay, no idea.
Chidanand, you know anything about Lilavati?
No, that started since our batch only, I guess. Uh, Not much of hands-on as far as I have heard.
Okay. Next, they're asking, how about GEM Chennai, Coimbatore, Amrita, based on hands-on and cases?
So GEM Coimbatore, as far as I know, is mostly only lab.
Yeah,
Do
only.
get hands-on, but not majors. I'm guessing only coli, appendix, hernias by third year, maybe a little bit more, but not majors. And they hardly ever do even emergencies and open, so you will not get exposure to open surgeries. I don't know how it is in GEM Chennai. Amrita again is good. They have exposure to both transplant and luminal GI. Hands-on is also good. The issue is the fees, basically.
Hmm. Okay. So next, they are asking, between SGPGI, AIG, KGMC Lucknow, NEEMS Hyderabad, and Osmania, what should be the priority order?
SGPGI, from what I have heard consistently for the past 3 years, people have regretted taking SGPGI.
Yeah, that's correct. Even I have the same information.
A lot of people have taken it for the name and whatever other things they have heard about SGPGI, but from the last 3 years, consistently, like I have people I knew from my MS days who've taken SGPGI, and most people have regretted taking it.
Okay.
KGMC Lucknow, from what I've heard, the general surgery branch is quite strong. The only advantage is that they don't have medical gastro, so you get to
Mhm.
do endoscopies and ERCP and all of that.
Okay. Then remains NEEMS and Osmania.
NIMS Hyderabad, yeah, you have a bond, even though you're at it's a DNB there, but you have 1 year bond at NIMS. And you could have good open exposure there. There is no advanced lab. That is the difference between NIMS and but and they also do 1 to 2 transplant cases per month. It's a bit low volume, but you get to do exposures there. So NIMS, if you are prepared to be okay with the hectic schedule, they have a very hectic schedule for first year basically. I've heard my friends saying that they go on at morning at 6 to 7 and things continue till 10 or 11 in the night. So it's that with that hectic schedule, they say the chances there, he feels it's not worth it, but you get decent enough cuttings there, NIMS, compared to most of the MCH institutes. NIMS, if it was an MCH, it would have gone far higher at a higher ranks than it is going usually because of the visits. NIMS you
Have
can
the NEEMS seats increased this year to 4?
no, it is
Or
four
was
only.
it always okay?
I don't know. I think it's four only NIMS.
Okay.
Was it increased?
No, it's 4 this year. I don't know what it was last year. That's why I was asking. Because if it has increased, it will make a difference to the working hours at least.
From 3 to 4 that it, I guess.
Yeah.
Okay. And does Osmania has bond?
Yeah, it has 1 year.
Okay. Nizams, I think you were talking about Nizams only, right? So
Is
that is
that-
done. How many bedded, I mean, AIG has how many beds?
Don't know. Enough beds. Surgical gastro only, I think in our app it shows like
No, no,
100
no.
to 150.
Consider the entire hospital. We have more than 500 beds. That's for sure.
I think it's 800 somewhere, right? I mean,
But it's 7 to 800.
yeah, it's how is Meenakshi mission?
I have heard good things about Meenakshi mission, but again, second-hand information. Like good academics, decent
Mhm.
hands-on, but don't know anybody, like haven't spoken to anyone personally.
Yeah, even I have it positively. The two residents whom our batch, no, a senior batch, they were happy with that Meenakshi mission. And even Aster Medicity Kochi, even that has also got good reviews. You get to do good colorectal exposure. If anyone interested in colorectal, they can consider Aster Medicity Kochi. You can
Mhm.
speak to the residents over there. Even they get to do at the third year laparoscopic colorectal procedures. That's what I've heard. So that's a good thing about the institute. You can consider even Aster Meenakshi mission is also a good option.
Hmm. Okay, this is new. How is Lizzie Hospital in Kerala?
No
I don't
idea.
know. It
So,
it
yeah,
was there during our time. Not sure. What about you guys?
Yeah, it was last year. From last year they started.
Okay.
not heard of it.
Anyone you know there?
No, no.
Sorry, guys, we don't know anything about that Lizzie Hospital. If we get something, we'll get back to you. And why SGPGI could be regretting?
China.
That's a nice one.
Toxic atmosphere, no cutting.
Mhm.
Yes.
And they
And
do have a bond, right?
they have a 2-year bond. And
Hmm.
also academics is not how it used to be before.
Okay. And
By no
then,
cutting, I actually mean no cutting.
Mhm.
In the entire first year, my colleague, the entire batch, only one person got to do one lap colleague.
Oh, that's like really bad.
Mm.
Okay. Then, how is Narayana Nellore? Any idea? Anyone of you? I have not much idea about that Narayana. Chidanand Jaini.
Oh, no, no.
Okay. Next, they have asked about Tamil Nadu colleges.
Tamil Nadu colleges, we had inquired about mostly colleges at Chennai. So
Yeah.
Tamil Nadu anywhere, there is a general disadvantage is that you have 2 years bond and the stipend is pretty too low, man. It's about 50, 55 bucks. So 55K bucks you get. And 2 year and generally Tamil Nadu, most of the colleges are toxic. That's what I've heard from our people who have gone from Karnataka and Andhra Pradesh. They feel Tamil Nadu colleges are toxic and speak generally most of the people see Stanley and Madras as the colleges which go at top. Difference between Stanley and Madras is Stanley, most of the HPB work is being done better at Stanley. Even they do transplant cases also. And the HOD is Jashwant sir. He is a bit supportive. He's pro-resident.
Mm-hmm.
So Stanley would be better in the colleges of Tamil Nadu. So next would be Madras. Madras may won't get more of HPB exposure. They're more of luminal cases. They do colon pull-ups, colorectal procedures. So generally they have that agreement also. Nagnath Babu sir is actually there. Most of the luminal cases will be diverted to Madras Medical College. HPB cases go to Jashwant sir, Stanley. So apart from those two, then even the colleges at Madurai, GMC Madurai and Trivandrum, I think Tanjavur. Consider these four in the order as far as I have inquired. I had inquired Rajmahendran sir also. Even he felt that the order is Stanley that he told me to me about 2 years back. Now you can inquire him.
Mm.
So Stanley, Madras, Madurai, Tanjavur.
Okay. Then, how about SRMC Chennai and Mahatma Gandhi Jaipur?
Not sure.
Even I never inquired about those colleges. Chiradan, you have any idea?
SRMC, I think Rahul sir is there. No, not much of idea.
And what about Jaipur, Mahatma Gandhi?
It's a pretty new college, but don't know. So, AK Kapoor sir is there. Academics will be good, but don't know much about hands-on.
Hmm, okay. Then, choice between Medicity and Lakeshore.
Aster. Lakeshore, if you are more interested in pancreas, because H. sir is the HOD there, most of the pancreatic exposure will be nice there, but you won't get much of cutting there. So if you're interested in colorectal, go for Aster. If you're interested in pancreas, go for Lakeshore. But Aster has got good reviews than Lakeshore at present also and even before.
Okay. And Kerala Institute of Medical Science. Any idea, guys?
Not inquired.
Okay. I have no idea about those. Then BMC and SMS Jaipur. I think Chidanand, you have better picture
Talking
of
about
this.
Kerala, I think Trivandrum has good reviews. The GMC Trivandrum.
I think even they have increased seats there 1 to 2, I guess. Now there are 2 seats at GMC.
BMC, like Bangalore Medical College, does not have good reviews. The general
Yeah,
surgery department is strong. They have fellows in GI and they also have this MCH in GI.
I think now the flow seats are converted to MCH. Now there are 5 seats
Okay.
at BMC.
But even then, I think it's not
Yeah, it's not worth it. I feel BMC has got generally negative reviews.
because both Chidanand and I are from Bangalore and both of us have taken BMC.
Okay, so it's definitely next they are asking at rank 400, which DRNB would you suggest?
In GI, I doubt any 100.
कीड़े हैं रूम में कीड़े हाँ बेड पे पता नहीं कीड़े
Okay, so rank wise, I don't know which college. Chidanand, I think you can answer this
It's
at
difficult to
400
tell.
rank.
I don't know. Difficult to tell. It's always the dynamics of counseling are difficult to predict. Based upon the last time counseling, I think you'll get a bit just a glimpse. I think bird view, but dynamics of counseling are very hard to predict. At super specialty stage, people prefer to be in their region. North people stay in
Yeah.
south. People stay in south.
Hmm.
Distribution and then think about your priorities and then put around. Let's say year.
And next, how is HPB at Mahatma Gandhi? I don't think I know this. You guys have any idea?
No.
Okay.
But
So,
in general, like one disadvantage of taking an MCS SPB is that it becomes very restrictive in terms of where you can go and work later. Like an MCH or DNB in surgical gastro gives you more freedom.
mhm.
CH and HPB will limit your choices a lot if you're looking to work outside of that institute at a later point of time. That is the feedback I had gotten when I was looking for institutes.
Okay. Bhushan is asking, his rank is 46 and he's from Maharashtra. He is asking which hospital will you be suggesting him?
You should suggest it.
What?
I think you should suggest you are from Maharashtra and your rank was also.
No, it depends. I mean, yeah, I'm from Maharashtra, but it depends. My priorities were different, and I wanted to stay close. I didn't want any bond. I didn't want to go far south or north. So that's why I chose Hyderabad. And among Hyderabad, AIG was the best. So that's why I came here. It depends, Bhushan, what are your priorities and what kind of work you want to do. I mean, are you interested in HPB or luminal? And are you okay with bond? What are your preference? Are you okay with DRNB or you want MCH? So it all depends on you. Your rank is pretty decent. I think you'll get into whatever you want to. So it's totally a personal choice, I feel.
At this point, I think there is no absolute right or absolute wrong, or
Yeah, exactly.
there's a lot of factors other than just the institute which are important.
Yeah, exactly. I mean, I feel the work environment also matters. I mean, you should try to choose institutes which have a good review in terms of environment. I mean, it does matter a lot because you're gonna spend your 3 years there. If you're gonna go into that toxic environment for one day, one day or the other, you will have some, break point or something like that. So for me, that was a priority. I wanted a good environment institute and no bond. So I think it varies person to person. If you're ready to work your ass off and you're ready to stay 24 hours in hospital, then maybe you can go ahead with the other institutes also. Okay, and then again, the DNB suggestions at rank 200.
So one more thing is, for us, it is a little difficult to answer according to this general rank because our batch had
Yeah, correct. We
city
had a different,
counseling, so we did
yeah.
not have this uh, confusion of whether people in front of us will take gastro or some other specialty.
Hmm, right. So rank wise, yeah, it's difficult to predict. Then how is NH versus Manipal versus Sakra? What is this Narayana, I
Oh
think.
yeah,
Uh,
Manipal, not very great. Uh, as far as I know, I have a friend who worked in anesthesia there, but this was at the time when Somsekhar sir was still doing onco in Manipal.
mhm,
Now his entire team has shifted to Aster in Bangalore, so I don't know whether cases have increased to the GI team or not. But previously they were not getting cases, and because of that, the DRNBP candidates were not getting hands-on.
mhm.
Sakra also same problem, not much hands-on. NH, I don't know. It's a new, I think NH is new seats, not very, maybe 2, 3 years they've started.
Mm, okay. CMC Vellore HPV.
I think you can answer that.
You think
No,
you can?
I mean, I think I would give a very biased opinion on this. So, Chidanand, please go ahead.
No. I heard something.
Okay, so, I don't know about, I mean, much. I mean, I just have one friend over there. I mean, he's overall has not given much good reviews about it because he said, I mean, the environment being toxic and less hands-on. But I don't have like, real first-hand information about CMC. You can add on, Chidanand. You must be
One
knowing few
advantage,
things.
I guess, is that they have a very structured unit, like everything is protocol based. So if you
Okay.
are very interested in HPB, and that is one of the options, maybe.
Mm-hmm.
But yes, toxicity even I've heard.
Yeah, it's really toxic, and the work hours are long.
Again,
So
I think even the stipend is a problem.
yeah.
Even in Tamil Nadu, that is a general problem. Toxic bond and stifle. These three issues are there. And think about HPV, like if you're want to go into transplant, you have made up your mind that you have to go to liver transplant, then going into HPV makes sense. But if you want to have a chunk of luminal exposure, decide at some point of later, then don't go for HPV. That you have to decide first. HPV versus GI.
Yeah, that's true. Okay, then Gangaram, how is the chance in Sir Gangaram Hospital?
There are not much as I said. It has got drastically the changes have been happening because senior faculty are leaving there.
Mm-hmm.
Generally, it's a negative review as far as I heard about Gangara.
Okay. Okay, then Sharang is asking LTMMC Mumbai, GEM, and GEM I think we already covered, and BL Kapoor. Any idea?
Yeah.
Sai, LTMC is new. That's all I know.
Yeah, yeah.
And yeah,
It was not there at our time.
yeah, it was not there. So I think with time only we'll know how it is working. And what about BLK? I don't know. I have much information on this. Anyone, anything to add?
No, not much.
Okay. Then they're asking about Shere Kashmir and Swims Tirupati.
Swims Tirupati, yeah, it is decent reviews. I got 1 year bond, good pay. See, bond and matters. You don't think much about it. Bond, so they have got a good pay, and even the exposure is bit good there. There are three faculties. There were three faculty. I don't know what are the present scenario. And one of the faculty was pro-resident of our joining. So you get to do bit of open cutting lab, no advanced lab, much of and there are fellows also there at Sims Tirupati. So that is one disadvantage. So most of your cutting shall be shared among the fellows and you. But and you get more of chronic pancreatitis cases there, and it is run by Trust Hospital. So that is one
Yeah.
more advantage. So you get lot of the more of the draining region is from south. So most of the people go there at Swims Tirupati, and also you get to do scoopies as well. There is no medical gastro there, so you get
Mm-hmm.
to scope. But so overall, it's a decent. I would say Swims Tirupati, you can consider it if it's in, and you are from south.
Hmm. Okay. And any idea about Shere Kashmir? I
Area.
think
From Kashmir, don't take share.
what?
Unless you are from Kashmir, don't go for share Kashmir.
Okay. Vinayak sir would have better idea about this. He couldn't join us today, but I think he'll update you in time. He'll give his share of opinion. Then Santokba, Jaipur, Medanta. I think Medant. They are asking about Santokba and Medanta versus Gangaram.
Vedanta versus Gangaram, I think he already, Chidanand spoke about that.
Spoke, yeah. And Santokba,
No idea.
even I have no clue about that. Apollo Indraprasth versus Gem versus Apollo Tamil Nadu.
Gem we did. Apollo's, no idea.
No, Apollo and yeah, even I don't know it. Narayana Rudayala, Bangalore. Did we cover this already, Narayana?
Yeah.
Narayana, no, not.
I mean, covered in the sense it is a new, the seats are new,
Mm-hmm.
and they do have general surgery also there. So we don't know what kind of hands-on they might be getting.
Mm-hmm. Okay. Then what would be the preference order of institutes for GI in Hyderabad? I think this is easy one. I know what AIG would definitely come first. Any difference of opinion, guys?
You're asking two people from AIG.
Yeah, we are from AIG, so yeah, we can give you a little biased opinion, but I think AIG should come first and followed by names, right, Janana?
Usmania also can consider.
Usmania. Okay. Okay, now you can put in order for them.
You are okay with DNB, I think AAG or else Usmania. Where it is, then NIMS. AAG equals Usmania, then NIMS. उसके बाद KIMS, then all are new hospitals in Hyderabad. Fortunately.
Okay. So again, guys,
We
yeah,
can,
you were saying something. Sorry to interrupt.
if it is 5 seats, we should rethink about Usmania. It was very good for one wrestle.
Hmm. Okay, so rank wise, we can't tell you guys. Then Apollo Indraprasth, we don't know. GMC Srinagar, between Apollo Indraprasth and GMC Srinagar, what's the better option?
No idea.
Even sorry guys, no idea about that. Then best colleges for MCH across India.
MCH.
Yeah, for MCH. I never researched about MCH. Didn't want a bond. But do you have anything to add, Chidanan?
Generally, people GB Punks.
GB Pant.
Yeah.
What is GMC Trivandrum is also this thing, na? MCH.
Yeah,
GMC
yeah.
Trivandrum is a good option. Other than that, I don't know, maybe you can consider Stanley, MMC, or KGMU.
Hmm.
And
Okay.
I mean, if you're then going for it, then SGPGI.
What's the stipend in Osmania and bond in Osmania?
I think across Telangana, it's the same that we are getting,
same
right?
Yeah.
same stipend. It's 80 after taxes. You get 81, 82 in first year, 87 in second year, 94 in third year.
Okay. Then Stanley versus Madras. I think this is covered. I mean, the kind of work they are doing. So it depends on what you want to do, I think. National Institute of Jaipur, any idea?
No idea.
Okay. I think Aster Medicity versus Lakeshore versus Tirunelveli.
I think he's covered Aster Med
Yeah,
City.
we spoke about Aster and Lakeshore. Okay. While selecting institute, what all things should we see in GI surgery department?
Yeah,
That's a
good
good
question.
question, actually.
That's a good question.
Yeah. You can answer. You go ahead.
Chids, you want to take that?
Then you go.
So I guess for me, one would be overall how the department is, whether it is resident friendly or not. I mean, we're all not young anymore. Have other priorities also. We cannot work like how we used to when we started MS General Surgery. So yeah, overall working environment. You like all GI institutes will not have good exposure to all things. Like AIG is good for luminal
Yeah.
pancreas. We don't do much of liver, or we don't have exposure to liver transplant at all. So that you need to know. So if you're someone who is more interested in liver and liver transplant, uh, you would not want to take a place like AIG. Uh, uh, Hands-on important. Even if not hands-on, I would say even what kind of cases you get to see in that institute, or even assist as a first assistant, that is important. Academics, whether you have people who are interested in helping you, and if it matters to you, thesis. A lot of people would prefer not to do a thesis. If you're taking DNB, thesis is mandatory. Bond would be important for me. And yeah, I think, did I miss out anything? These are the
Yeah. Think yeah, these are the things we keep in mind. I mean, obviously the order of among this would change from person to person. And Chidanand perhaps can add few points.
Yeah, see, general GI surgery is basically you are an advanced general surgery basically. So general surgery may whoever they would have almost learned few things, and will be our learning will be more refined and more advanced at the end of these 3 years. So exposure and hands-on, these two, and in which field, because general surgery again, sorry, GI surgery again has got subspecialties: colorectal, upper GI, HPB, bariatric.
Hmm.
So again, even HPB, if you are liver surgeons, if you are pancreas surgeons. So it's difficult at this point to decide. If you have decided, good, go ahead with it. See which what is that institute is providing and accordingly choose. But most of us won't be decided yet. So in that case, go for institute which is offering all such exposure, and accordingly you can decide later on. And families matter. We all are grown up now, so uh, choose the institute nearby you, I would say. and quality of life also matters at this stage of life. So we cannot compromise much in terms of quality of life as well as we did in our PG days. So again, DNB versus MCH, we all three will agree that you not scratch much over it, scratch or hurts much over it. It's almost equivalent. Even if you want to go back to government setup, maximum you would be about 1 year behind MCH candidates. That's all. But if you do 1 year in any corporate setup, then it's considered equivalent only. You can go and join. So don't hesitate in terms of DNB versus MCH. Few old-fashioned and conservative people might tell you to take MCH over DNB, no matter if you got a DNB, good DNB institute. But I feel that should not be the case. Uh, and interact. When you are asking us, we are giving in second-hand opinion, but interact with the people there who are presently working as residents. They would be better. They would give you a better picture than us.
Yeah, that's right. I mean, you'll get the present situation, how the things are working there. And I think the more you look, the more you're gonna get confused, and you can get a fair idea. You can look at the last year's allotment, and you can get a decent idea of at your rank what all institutes are possible, and then sort those out. And you can try to get in touch with the residents over there and talk to them. I think that will clear the picture in your head. I mean, which institute to choose. Then, what are the lab chances in Osmania?
Not much, not much. Only open air today. Only
Yeah,
Kohli appendix.
okay. DNB in IGOT Bangalore versus BMC MCH Bangalore.
I, IGOT is more of HPB if I'm not wrong, because it's mainly only liver transplant.
What should be a final year resident be able to do independently according to you? This is a nice one. Chiradan and Jenny pitch in, please.
This reminds me of Pradeep sir, I think. So just what we are taught at AIG is that you should be able to, like, if you ever go outside and start your own practice, you should be able to handle any case that comes to you. So pre-operatively, post-operatively, uh, hands-on, maybe it is not equivalent to the cases we see, but uh, I think simple laparoscopic cases like cholecystectomies, appendectomies, maybe even inguinal hernias, and most open cases, except maybe liver resections and Whipples, you should be able to handle independently. I think, do you agree?
Maybe now Whipples may not be every institute. You may not be
That's why I
possible.
said other than Whipples and liver resections.
Yeah, even I feel colorectal,
Yeah, yeah, colorectal.
Colorectal, small bowel, stomach, you should be able to handle. Again, esophagus also, I don't think final year.
No, I don't think esophagus. We don't get much exposure, and it's so yeah. Okay, what we usually get to do in MCH and DNB. I think
depends on
it's
it's not
yeah. Go ahead, Chidan.
MCH and DNB. It's all the which university and which board is giving you the degree, but it's largely depends on institute which you are going into. Degree doesn't depend. Degree doesn't matter as much. So DNB in a better institute is always good than MCH in a bad institute.
Yeah, I think academics should be given importance because you learn. I mean, you learn when you keep, your academics is strong. So choose a institute which has a decent academics as well. How is some Bhubaneswar?
Idea.
No idea. I did
No
not
idea.
surgical gastroceles.
Okay, so then Akshay is asking hands-on good but bad academics versus good academics with okay hands-on but good quality case exposure. So you have to find a balance. I mean, you can't compromise on anything. The academic should be, I mean, should be decent, and hands-on should be, like I said, it should be mentored. It should be supervised.
How can you
All,
have good hands-on with bad academics? Hands-on is good
yeah,
only when it is supervised.
exactly.
Unsupervised at a super specialty level is not going to give you any added benefit.
Yeah, right. Okay, so I don't, yeah, Ankur will be putting the video in the group, or maybe the link would be put. He will update you about that. What is the passing percentage in DR and B gastro? Are practicals difficult to pass?
What is the pass percentage?
There's
Two-thirds?
considerably improved over
5
years.
by 6? Yeah, it's improved. That's true.
Mm.
Oh,
So matlab, then it all again the dynamics of exams are very difficult to predict. It all depends on who is the examiner coming to you, how is your presence of mind then. So practicals, it's different from MCH in the aspect that in MCH you will be having your exams in your parent college, but it's not the case in DNB. We usually go to some other institute, so we don't have that homegrown advantage in DNB. So that's why generally DNB exams are difficult than MCH exams to pass. That's what the general consensus is. But we have seen that if you are like good quality students who are overall going out, they have considerably passed in single attempt itself. So compared to the ester years, DNB practical gastro, there is a considerable improvement as far as I have heard, and we're seeing it also.
yeah. Okay. Then, what to choose between the last GI institutes and the good onco institutes? If we have GI and onco preference equally, I mean, if the preference is equal between GI and onco, then what to choose? That's being asked.
Good onco. Always choose a good center over
Yeah,
anything else. I mean, if you're interested.
that's right. And Dr. Rela Institute or IGOT Bangalore?
Rela Institute.
The spectrum of work is but Rela Institute, I think.
IGOT is a very new center. I think they got a license for transplant at last year itself. So and there is not much of see in HPP, especially in transplant centers, you cannot expect most of hands-on. You'll be learning only. At the end of 3 years only, maybe they will give you donor cases. They start giving you. So, but since Rayla Institute has got a good exposure, I would say Rayla Institute than Bangalore.
Yeah, I think I agree.
Okay, so with okay, future of liver transplant.
That is too,
The present.
too meta.
It's
Okay.
I mean, liver transplant is not going anywhere. So
Okay. National Institute of Gastroenterology, Hyderabad. Any idea?
no,
that
no,
would
actually.
Is it a new one?
Yeah, it's this time they've added 2 seats there.
Oh,
One seat I feel. Don't know what.
okay. Then next year, if you get in there, you tell us how it is because we don't know. And liver transplant exposure rate, AIG versus Osmania versus NIM. So I can answer the first one. At AIG, we do have a separate liver transplant unit, but we don't get exposure, and residents don't get posted there. But if you're very enthusiastic and if you can find out time in your busy schedule, you can go and see there. No one is going to stop you. I mean, for emergency cases and all, they can ask for help at times and you can go in, but no routine come mandatory exposure in AIG. Osmania and NIMS liver transplant, you guys want to take it?
Names you have, as I said, like they do transplant cases about one in a month or 2 months, not very low volume of exposure. But yeah, you have exposure of transplant at names. But
Hmm.
the quality of work, I don't know how good it is, but something is better than nothing. So NIMS has got good transplant exposure. Osmania, they're not doing transplants, though, but they do liver cases. They do. Hyperectomies they do. Only at NIMS you have transplant exposure.
Okay, the last question on the box is IPG MER Kolkata. What's the work and toxicity?
Yeah. Yes.
No, we don't know.
Even I don't know. You'll have to find out someone who is there. Maybe on the group you can text and find out. I don't have any idea. Chiranand, you know anything?
No, I haven't asked about IPG.
Even I didn't ask. I didn't bother that time. How is Global Hyderabad?
Again, fairly new, if I'm not wrong.
Yeah. Not much idea about Global right now. I think Yashoda Somajigoda. Chiranand, you know anything about Yashoda?
You show the thing that Kona ma'am is that ma'am has got good name. Kona Lakshmi, I guess. So she got exposure is good at Yashoda. In any D&B institutes at Hyderabad, not much of hands-on, but academics is also not that good. So not great reviews about Yashoda Hospital. But you have good, you get to see good variety of cases. They attract people, and also she has got good name.
Okay. 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 One last question. Can you tell us the order of college in Tamil Nadu on the basis of cases and work? I think this has been covered, but we don't mind repeating. Chiranand, do you mind repeating once? Tamil Nadu order.
Tamil Nadu order, as per Raj Mahendran sir, it is Stanley, then Madras. Kilpauk also you can consider after Madras,
Hmm.
or you can go for Madurai, Tanjore. These six cases are.
Okay, so there are no more questions in the chat box. Any more questions, guys? Okay, so I don't see any questions here. So I hope this was of any help to you. If you have any more questions, you can drop in the WhatsApp group. We'll try to answer them. Okay, one last Kim's Hubli. Okay, so Kim's Hubli is relatively a new college, and the HOD, I mean the consultant there is fairly pro-resident, and you do get a decent hands-on. They are doing variety of cases also, including coloplasty. But with time only we'll know. The department as such is not toxic. The number of residents are less, and I think they have got some fellows also. So it's a decent institute, Kim Sugli. Anything to add?
Yeah, I think it was added our batch only. Two seats
Yeah,
are
it
there.
started with our batch only.
So before that, they had a fellow, and they have, I think, only two consultants. So
Yeah,
one HOD is not much pro-resident. Another one is Arvind sir. Arvind sir, he is very pro-resident, I
yeah,
must.
he is. Yeah,
So he get good cutting, and I think our batchmates, one of I know her that they're happy with that comparatively.
yeah. I mean, yeah, even I heard the same things. Whatever they are getting to do, they are happy with it. Yeah, that's right. Okay, swims we have already covered. It's a good one. Okay. Better DNB Institute in Karnataka since you told BMC is not that good.
Karnataka does not have very good institutes, I think, but maybe you could, I don't know, Manipal or Sakra if you really do want to stay in Karnataka.
Hmm. So I think we can wind up this session if there are no more questions.
Mm.
Okay, all the best, everyone. I do hope you really get into the institute of your choice. And if you do get into GI surgery, hope to see you at conferences soon. Okay, thank you very much. Have a good night.
Thank you.